Well, our work with the President's Malaria Initiative and in malaria is one of the most profound successes anyone has experienced in global development anywhere around the world. I just had a chance to review data from 7 countries where the PMI has scaled up access to very low-cost community interventions like getting insecticide-treated nets out to protect kids. And those programs are having tremendous success, leading to a 30% reduction in all-cause child mortality, which might sound technical, but it's actually an amazing result. And what it means is that hundreds of thousands of kids will live in sub-Saharan Africa instead of dying unnecessarily from malaria. And this is taking place at very low cost and, frankly, too quietly. This is a great success story, and we need many more people to recognize the power of this program. Well, the President's Malaria Initiative is a profound program, and it's profound because it really took the concept of malaria control and prevention outside of a hospital context where we were just trying to treat patients that came in with fevers. 30 to 40% of all hospital visits in sub-Saharan Africa are people with malaria. And that is a consuming and important but insufficient strategy to resolve the problem. What PMI actually did was get out into the communities, and I visited schools in Senegal and local communities of faith in Kenya and other parts of Africa, where they're out in the communities, they're conducting plays and programs of education with kids and mothers and parents, and really making sure that people have their homes sprayed for indoor residual spraying so that we can reduce mosquito loads that, of course, are the vector for transmission of disease, and making sure kids have access to knowledge about how to protect themselves and bed nets to sleep under safely. And getting out of the hospital and into the community has been a major part of the success story. As I look forward over the next several years, we need to continue to be community-based in our approach to malaria prevention, and we also need to start introducing some new tools that will really help us in the long run. The most important of those probably is a malaria vaccine, and we suspect we're very close to having a malaria vaccine that can really ensure that once we've taken the burden of disease down, we can keep it down for a very long time and very efficiently. So the trajectory here is going to be great if we stay focused and if we continue to make these investments in community-based prevention, in improving treatment strategies, and in making sure we get a vaccine out there to actually help eliminate this disease over the long run. Well, effective foreign assistance is critical because at the end of the day it's about generating real results that a family in Indiana can see and feel and understand as to why it helps them lead a life that is safer and more prosperous in the long run. The work that USAID does in global health and in so many other areas of global development contributes to our own national security. It's how we project our values around the world, and it's how we ensure that we have trading partners that are prosperous and effective trading partners, so we have a growing economy. It's how we ensure that countries that otherwise would be fragile states and where we might need to intervene militarily to protect populations or to secure our interests are stable and thriving so that we don't have to do that. As Secretary Gates has said, it's a lot cheaper to do development than to send soldiers. And what we're seeing in malaria is a great example of that. When you're really results-oriented, very focused, and making investments that generate real results, it helps make sure that entire continents are laying the groundwork for economic growth and stability. And in the long run, that's very, very, very useful for us.